Hi everyone, it's Dr. Ansari. I'm going to talk to you today about types of urine leakage, okay? There are different reasons why people leak urine. So if you've had a treatment for urine leakage in the past, you might still be leaking urine because you have a totally different problem, okay? So there are mainly two types of urinary leakage, something called stress urinary incontinence and another one called overactive bladder, or it's also called urgency urinary incontinence. Okay, you might hear both terms. Okay, so stress urinary incontinence is leaking with a cough, sneeze, laugh, exercise, all right, any kind of jumping, walking, right? That's stress urinary incontinence. This is caused by muscle weakness, okay? It can occur with having full-term deliveries, mostly vaginal deliveries, but you still can get it with a C-section. Or perhaps you had a hysterectomy and all of a sudden you start leaking with a cough, sneeze, or laugh. Certain surgeries can also cause this type of problem. A lot of times treatment for this may be what you hear people say to do Kegels or strengthening the vaginal muscles by contracting them or exercising them. You can also get a sling or do urethral bulking for this type of problem, okay? Now, on the other hand, overactive bladder is the type of leakage of gotta go, leak before you get there. You've got to go so bad that you don't make it to the bathroom, to the toilet. Okay? This is important because the urgency problem is not the same as leaking with a cough, sneeze, laugh, or exercise. Not the same. So this is caused by a nerve issue, okay? Not a muscle problem directly, it's a nerve problem. The nerve is misfiring, causing your bladder to have spasms, and it all of a sudden just triggers the bladder to contract down and squeeze down, and all of a sudden you've got to go, and then you may even leak before you get there. This type of problem is treated with medications or pills that you take. It can be treated by Botox to the bladder or by different types of nerve stimulation. Okay. So if you've had treatment of one of these, that does not mean that you've solved all of your leakage problems. You could still develop the other kind. There are still other types of urinary leakage problems, so it's really important to see a doctor to see or try to figure out why you're having leakage and what kind of treatments are necessary. You may require further testing in order for the doctor to figure that out. Oftentimes Urodynamics, which is here, I'm going to write it down here, Urodynamics, is a test. Urodynamics is a special type of bladder EKG that's done to help figure out what kind of problem you have. So you may require that. Many people have both types of leakage happening at the same time, so you may require multiple therapies, meaning you're treating overactive bladder with medication and then you're putting in a sling, for instance, for the stress incontinence. And depending on which one is worse, if the overactive bladder is worse than the stress, you might go in a different order compared to someone who has stress that's worse than overactive bladder. So everybody's a little bit different, and we have to tailor the treatment to you.